Okay, we're going to switch over to the butterfly loop. The butterfly loop again is 8 wires, and you put them together, now we have 16. So now we have a stronger field in a smaller area. This is great for joints and extremities. Now, when we get all the way down to the foot, that's as far down as the most extreme we can go from the torso. So when I turn this on, sometimes it's a little hard to feel the full intensity, especially when people have injuries or neuropathies or things down in their foot. But most people can get a sense of what this feels like. Can you feel that in your foot? Okay, so you're going to feel that. Now, what I want to explain here is that this butterfly loop, just because it's going through the ankle, the field is traveling in and out of the field this way. So when I move this around and put it into a different angle of the body, does it feel a little different? Okay, so what I want you to do is I want you to, if someone's ankle comes in and their ankle hurts, I don't want you just to do that and tie it off and you'd leave. What I want you to do is I want you to find the angle that feels the most effective for them. And sometimes it's behind the ankle, sometimes it's under the ankle. I'm thinking of this knot here. By moving this knot around to different areas, sometimes we get a much better feel. Does this one feel a little better than the others? So I would rather do 3 minutes with the butterfly here rather than just tying it on and walking away, okay? We want every single 3-minute session to be as effective as possible. Now, I'm not getting a lot of movement with the foot right now because they're small muscles, small bones. It takes a lot of magnetic field to fire those and make them move. But watch what happens when I come up to the calf. When I come up to the calf, you're going to start to see the foot move, okay? And that means we're firing muscle and nerve, okay, to make the foot move, okay? So if this was like a current, it would only fire the muscles in the calf. This is a magnetic field firing nerve, muscle, all the way down into the foot, okay? So it's a little bit different technology. Now, if I move this knot just a little bit medial, his foot went from tapping like this to now it's going side to side. Do you see that? So I'm actually hitting a different nerve. There's 2 nerves that come down the back of your leg back here, and I can choose which one I want to hit a little harder. Does that feel a little different? Okay, so now we have the ability to kind of see what path from this foot to his brain may need some attention. So whenever you're working on somebody with feet or ankle issues, you always want to follow the nerve pathway back to the brain. And you can look for different nerves just by moving this knot around. Some people may have some shin issues, put the knot on the shin. Some people may have some Achilles issues, put the knot right on the Achilles ankle, okay? And it's okay to squeeze these down and push on them. That's what they're designed for. They're designed to get into the area that you need it, okay? So what I'll try to do with people with nerve damage, neuropathies, burning sensation, tinglings, try to follow this nerve path back to the brain. And usually I can find what we call the hammer. And the hammer is kind of that spot. If you guys start playing with this machine, you're going to feel a spot that just, it goes right to it. It's kind of like a deep tissue massage when the therapist hits that knot. That little hammer that you feel, and every time it pulses, you'll feel that hammer hit. That's what we're looking for in their body. So with the butterfly loop, think of this as like a pointer tool trying to find the area. Let's check his knee. Okay, so his knee, again, not much going on here. Relax your leg a little bit, Jim. Okay, and the foot is moving just a little bit. If I wanted to move a little more medial, I can still see a little movement in his foot, so I know the nerve pathway is working well. And if I wanted to check this nerve over here, okay, it checks for movement. Now look at it move, okay? So now we have tons of movement. So this nerve is probably a much better 3 minutes than just straight on, okay? So while you're working with the patient, they have numbness in the foot, and I can make it move right here. It's moving pretty good. And then I can make it move right here pretty good. And guess what? I'm going to keep going up the body, and we'll talk about doing the hips and the thighs in just a second.